Okay, welcome everybody. We've got probably 1 minute before we'll start the webinar, so we'll just welcome you all at this point and remind you please to keep your microphones off to help reduce noise and feedback and disruptions, and also to keep your camera off as well, please. So what we're doing today in this webinar is encouraging you to use the chat to post any questions, thoughts, observations or queries that come up for you. And we hopefully will have some time towards the end of the hour where Carrie, one of my colleagues, will be capturing some of your questions to pose to the panel. So welcome everybody to today's webinar on can we overcome rhetoric and address the tensions of workplace well-being. So as I said, if you could keep your cameras and microphones off and use the chat function to post your questions or any observations, comments or queries you have about today's webinar. So welcome. Thank you everyone for joining us. My name is Sally Hardy. I am Professor of Mental Health and Practice Innovation at UEA, and I am a member of the Impact Research Group here looking at system-wide transformation. Okay, as you join, remember to turn your microphones and cameras off, please. Thank you. So if we move to the next slide, thank you, Heather. So today's webinar, I am joined by a couple of colleagues from the university, one of which is in our business school. The other two members are going to present are from the School of Health. So I will invite both Kevin, Christy and Jonathan, please, to come on camera and just to do an introduction of yourselves before we move into the webinar per se. So welcome. Kevin, do you want to go first?
Okay, thank you, Sally, and hello, or good afternoon, everybody. So I'm Kevin Daniels. I'm an organisational psychologist that works in Norwich Business School, and I've got a long-standing interest and in policy and practice around sort of workplace health and well-being and safety as well.
Perfect. Thanks, Kevin.
Hi.
All right. Who's that next? Jonathan, was that you?
It was me. I was jumping in, Sally. With
You're so excited. Yes.
I'm so excited by the webinar. So it's really good to be with you all this afternoon. I'm Jonathan Webster. I'm Professor of Practice Development and co-director of the Impact Research Group. So it's good to be able to join with you.
Thanks, Jonathan. Christy, last but no means least.
Hi everyone, I'm Christy Sanderson. I'm a professor in applied health research in the School of Health Sciences, and I've been looking at various aspects of workplace wellbeing for probably the last 20 years, but have a current focus and interest on health and social care workforces. Great to see you here today.
Thanks, Christy. So my other colleagues are Heather and Rebecca are our support team, and Heather is working the slides for us. Thank you so much, Heather and Rebecca. And you will also meet Kim and Carrie, who will be monitoring the chat, and Carrie will be tabling some of the questions towards the end. So thank you. And as I said before, welcome everybody to this session on well-being. So if you could do the next slide for me, please, Heather. So we're looking at well-being, and you will often see in the literature two ways of spelling well-being. One is, if you could turn your microphones off, please, whoever's just joined us, thank you. So well-being can often be presented as a hyphenated in terms of our well-being, which is very much probably more focused on self. And then well-being has been used, I think it came out of the American literature, and is a much broader term and an umbrella term that captures different aspects of well-being. And it is this broader aspect that we will be exploring today. So we are recording the session for people to watch and listen again, and anyone that couldn't join us today. But what I just wanted to say at the beginning, if anything does come up for you that perhaps you haven't thought about before around your well-being and your workplace context, then we are giving our email addresses at the end should you want to pick this up with us at some other point. But our approach today is inclusive. We believe that well-being needs to take into consideration multiple perspectives, multiple areas of evidence that is often very hard to capture through research, and also is a very inclusive process. So we've got the theme of our images here of the donkeys carrying the load, and are often the workhorses, aren't they? They're depicted as the real workhorses. And again, I personally tend to use humour to de-stress and as a leveler. So I hope again that we do not offend if we are using humour in some of the conversations that we might have, but also about thinking of well-being, like I said, in its broadest context. So today we're drawing on research and looking at the strategies and interventions that are around in terms of, can you measure well-being? How will I know that my well-being is being affected? What is the expectation I can have from others? And then what do we do collectively to make a difference? So next slide, please, Heather. Well-being and issues of psychological well-being, physical well-being has been around since ancient times. And we know that people in ancient and indigenous cultures would share their earth wisdoms with each other through storytelling and through art and imagery, the cave drawings that go back to 3600 BC, for example. We have ancient Hindu texts that talk very much about having a mind-body balance and interacting and understanding the world within which we live. And then, of course, you've got the Greek, Rome and Asian cultures, classic texts about health and well-being. I love the phrase in Romeo and Juliet where he says he jests at scars that never felt the wound. And sometimes it's very difficult for us to understand how people react differently to different aspects of their context, and their well-being shows in very different ways. The very classic work of Isabel Menzies Lythe, understanding professional workplace contexts as a defense mechanism against anxiety. And then you've got Horsechild's work and Pam Smith's very famous work on the emotional labour of professional caring, which probably then moves into the occupational stress and burnout literature that was around. And that we have looked more towards resilience and mindfulness in the 2000s. As you are very well aware, we have been through a very unprecedented year with the modern day COVID, and understanding well-being in the workplace has taken on a whole new meaning for us all. So next slide, please, Heather. So I looked at some of the contemporary literature and I found one from this year that looks at women's healthcare in particular, because what's been interesting to look at some of this COVID research is how women have been particularly affected. And this was again looking at occupational stress and burnout during COVID from the BMJ Open. So the literature search identified 6,148 citations around this topic. But then because they had their specific criteria, they looked at 47. But what I wanted us to focus on today is that very last sentence there in the conclusion, that there is still very limited evidence that exists about the organisational interventions that can help us. how we modify our working conditions, the importance of financial security and financial well-being, but also where and how do we influence system level improvement. So that is the focus of today's webinar. Thank you, Heather. Next slide, please. So I'm now going to introduce and hand over to Kevin, who's going to take us through the work that he's been undertaking, looking at different perspectives about well-being in the workplace and what does that mean in terms of research. So thank you, Kevin. Over to you.
Hi, thanks, Sally. So if we could have the next slide, please. Thanks, Heather. So you may have noticed a few logos on the first slide. I have to make the acknowledgements at this point. The various grants that we received from primarily the Economic and Social Research Council, but also doing a bit of work with the City Council at the moment as well, with something called the Norwich Good Economies Good Jobs Project with the Knowledge Good Economy Commission. And as part of all this, I get to work with lots and lots of people at UEA and other institutions as well. So it's kind of acknowledgements to all those guys that are listed there that I've worked with on the various projects. Okay, so if we could have the next slide, please, Heather. Thank you. So I wanted to start off with something which is a debate in human resources management and relates really why organisations should be concerned with well-being and in an indirect sense why this would link to systems perspectives, which I'll come on to in a second. But essentially, there's a debate around the employment relationship, and it's a long-going debate about what do workers get out of the relationship with their employer and vice versa. And this can be polarised into two different areas. There's more nuances than that, but one perspective is basically it's called a mutual gains perspective, and this is the idea that human resource management as a kind of function in management, that its function is to balance multiple stakeholder concerns and predominantly between the employee concerns for having interesting work or safe work or well-paid work, and employer concerns for a productive and motivated workforce. And within this kind of mutual gains perspective, the idea is that if you address worker concerns and needs, and these include health, safety and well-being, then what would happen is that workers would reciprocate through norms of reciprocity and social exchange by being more productive and more motivated and working harder. So within that broad perspective, the idea is that productivity and well-being are linked. And one drives the other. And if you get a systems perspective by providing interesting work, with decent work-life balance and a chance for people to input into decisions and feel supported at work, then they'll respond by being more productive. The more critical perspective is that productivity and well-being are seen by managers as not being linked, or even antithetical, that you have to work people hard to make them productive, and that's antithetical to well-being. So within this particular perspective, the argument is that basically workplace well-being is the responsibility of employees. So this is about individualisation of practices and not looking at systems perspectives on health and well-being. So to some degree, you could argue this neglects the employee's duty of care, which is, in UK health and safety regulation, that workplace well-being is something that employees have a duty of care to address in one way or another. Now, the balance of evidence around this particular debate is that organisations do get mutual gains. So organisations are more progressive in their people management practices and emphasise well-being in those management practices are more likely in the longer term to be rewarded with high levels of motivation and productivity. And there's some evidence for this actually comes from studies of the National Health Service and using data from the NHS staff survey. So that's the balance of evidence. But of course, to have organisations who are progressive to make the comparisons. We do know there are some organisations that are less progressive in their approach as well. So the question is, why might be this the case? So can I have the next slide, please, Heather? So one of the things we did as part of our research program, we went out and talked to workers and managers and different stakeholders and experts in the employment relationship, like people from ACAS. And we kind of looked to see, well, what are their conceptualizations of well-being? How do they understand well-being, and how do they understand what are people's priorities for well-being? And a really interesting thing here, so we went around the country and we talked to everybody using a variety of methods, and basically anyone that would talk to us. And what we found was a large convergence between scientific conceptions of well-being and stakeholder conceptions, and convergence between workers and business owners and managers around what well-being is. So if you ask people what to them is well-being, it's either positive emotions, feeling positive emotions, a sense of happiness and life satisfaction, and also what in psychology and philosophy is known as eudaimonia, the sense that your life has some kind of meaning, purpose, self-determination, and relationships, good relationships with people. People did mention good physical, predominantly mental health, but good physical and mental health falling into the well-being space. And interestingly, in relation to workplace well-being, everybody talked about productive economic activity. So there is this kind of understanding there is a link between well-being on the one hand and indicators of productivity on the other. And this, whether it's productivity as in workplace performance or less sickness absence and less presenteeism, there was that recognition that was there. Also, what came out was for workplace well-being, it is having a sense of community as well, a sense of identity and belonging, a psychological space where you have some connection with other people. So this led us to the idea that what you should be looking for in a health and well-being program is to certainly address happiness and well-being as around emotions, but also look at those social connections as well between people as being quite important, and also bear in mind that people do see productivity as something that goes along with well-being, so they're not antithetical at all. The interesting thing, if we can have the next slide, please. We did talk to people about what's a priority and a big driver of their well-being. Again, a lot of convergence around it's how I do my job, what my day-to-day working environment is like. So it's not necessarily, as we sometimes call it in our sort of research stream, yoga and Pilates or lycra and lettuce. It's not necessarily just a health and well-being program. It's what people experience on a day-to-day basis in the kind of work that they do, the relationships they have at work with their managers and their co-workers as well. Interestingly enough, though, workers tended to prioritise interventions at the systemic level, and to some degree managers tended to think, well, actually there's a little bit more individualisation going on, but these were differences at the margins generally. So through our work, we've looked at how organisations try to implement different practices and combinations of practices to improve well-being at work and protect people's health. So although we see that worker and manager and scientific conceptions tend to converge, there are some differences at the margins. So this leads to, there has to be a negotiation process going on as well. And as we've seen recently, sometimes very, very catastrophic things can happen, but organisations are dynamic entities, everything is changing. So priorities change because things change. And also you've got different stakeholder groups in organisations. So your workforce is not an homogenous bunch of people. They're all different people with different identities and different backgrounds. So there has to be this kind of process of negotiation that takes into account the divergent needs of different groups in the workforce as well. And that is necessarily an ongoing and dynamic process because it is complex to do so. So we're in the process of developing this model, and I suppose to come to a conclusion on this, what we see as critical success factors in approaches to managing well-being is a progression and build-up of practices. Over time, organisations that are good in the wellbeing space tend to do that. But underpinning that, and the critical success factors, is the idea that you adapt the programme because the process is ongoing, and you're not always going to get everything right first time anyway. So you have to have the means to adapt, change things, and to adapt, that means essentially building in processes of learning and data collection and data collation and data interpretation. For larger organisations, it's going to be around surveys. For smaller organisations, it's just simple as asking people how they're getting on and what they think about things. And the final thing that we say is absolutely critical is this idea there has to be continuity. It's not a one-off activity. It's a dynamic process. It's ongoing, and we would see it in the same terms as continuous improvement. So you have to take into account and go in with your eyes open. This is not just a one-off activity. It's not something you can do in January and forget about it for the rest of the year. It is an ongoing process that will build up over time. And we've got a number of different contexts in there. But I suppose one of the important things is the idea that you have a managed program, which we call the delivery context, and that's the idea that different interventions will fit into an overall program in different ways, and there is a coherence in how that is managed. So there is kind of formal governance structure. It doesn't have to be, written down or anything like that, but there is a governance structure. And the last things I've mentioned are the different approaches to introducing practices. So generally, it's the literature seems to indicate the best thing to do is introduce practices in a way that are consistent with existing norms and processes. So it disrupts the business of the organisation less because things fit in. However, what we do see is in some organisations where existing processes are dysfunctional, such as norms around abusive supervision, then new norms have to be created. So the kind of fracturing of processes seems to be important to introduce new and better norms and processes. And also bearing in mind that we have multiple practices going on within an overall programme and different things. It's important to have, we call this gestalting, in sort of academic writing, which is this idea that you bring coherence, you bring things together so people can see there is a consistent pattern. So what you would find is in any organisation, things around equality and diversity and inclusion can fall under wellbeing because it's addressing specific concerns of specific people. Things around HR processes and people management and management development, that can fit under wellbeing because it's about how people are managed. And your standard occupational health provision or sort of health promotion program will also fall into that. So there's any organisation will be doing a lot of things if they're doing it right. So they need to have some way of communicating that there is a consistency and coherence to what they're doing and bringing all those things together. And I'll finish there if that's okay. So thank you to Heather for moving the slides onto for me.
Thank you, Kevin. You've got a resource slide next. Do you want to just talk through some of those for us?
Oh, yes.
Or do they stand alone?
So the what works wellbeing, so I've gone through this in a kind of more academic way, if you like. If you want access to this stuff without all the academic talk about gestalting and fracturing, then look at the What Works Wellbeing website, where we've put some more practice focused language, case illustrations for guidance of workplace wellbeing. The evidence underpinning some of that is at the Work Life app, that you can get through from the guidance for workplace wellbeing site. There's also something called the Propel Hub, which is stands for Productivity, People, Engagement and Learning, and one of our research programs fits into that hub. So there's more about people management and wellbeing there, especially a really useful resource on managing remote workers. And for those of you, I see from the chat, many of you are sort of health and medical professionals. We did something for the Society of Occupational Medicine about specifically how occupational health practitioners can help build wellbeing programs and work with HR practitioners in organisations. and we have a Twitter account as well, where we post things occasionally. So
Lovely. Thank you, Kevin. There's some lovely questions coming up, so have a look at those so that hopefully by the end, when we get some time to address those. And I just love that idea of a new gestalt that keeps forming, and the dynamic of that. I think that fits very well with the human flourishing literature as well, doesn't it? That, you know, well-being at work should actually allow us all to continue to grow and develop. So lovely insights there. Thank you, Kevin.
Yeah.
So we're going to move on now to hear of Christy's work, which is specifically in the health and social care context. So Christy, do you want to come and talk us through your research, please?
Great, thanks very much, Sally. And what I'll be talking about follows on very nicely from Kevin's overview, and hopefully we'll draw out some examples of the types of concepts and understanding that they've been able to draw out from their research so far. So I'll be talking through just some snapshots from some recent research work we've been doing in the ambulance sector. For me, this is a really important sector and critical sector to understand in terms of workplace wellbeing with the NHS, partly because it's almost a well-functioning ambulance sector is critical for pretty much any other part of the health and social care system. And likewise, it relies on well-functioning health and social care systems across the board. So it is very much a service that is kind of stuck and highly reliant on the performance of other sectors that it necessarily interacts with. But also because Kevin mentioned the NHS staff survey, if we have a look at that, it seems to be year after year, the ambulance sector kind of as a group of trusts seems to come out poorly in league tables, whether we're looking at quality of staff experience in terms of bullying and harassment, whether we're looking at staff perceptions of whether they feel their trust has an appropriate and positive attitude to workplace wellbeing. There has been little bits of improvement over the years, but there seems to be some sustained areas where, as a collective group, the ambulance sector appears to stand out poorly in terms of staff experience. So I think trying to understand how we can apply these conceptions of wellbeing to understand how we can improve the staff experience and patient and service user outcome, I think is really important. So some of what I'll talk about may be specific to the ambulance sector, but a lot will be generalisable, as we know, kind of from other settings. Next slide, please. Great, just to kind of set the scene, these two quotes we kind of got early on when we started this work, and I think they will resonate for a number of you, I think. We had one frontline clinician tell us that management, of course, they know what the issues are, but it feels like there's this inertia. It feels like nothing really changes on the front line in terms of what staff say. If you ask very senior managers, they'll say, but we're doing everything. Look at all these things that we've rolled out for staff experience and wellbeing. But often it's that understanding of, was it implemented properly? Did it work? Was a new initiative kept for long enough to actually have a difference? Were staff accessing it? If not, why not? Is it a work barrier? Is it some other barrier? Is it just a program that wasn't fit for purpose? So we do have this tension between, if you ask senior management, they will have some very positive stories about what's happening. And then if you ask the staff, there will also be very positive stories about what's happening, but also some really clear understanding of where the gaps are and where the rhetoric isn't getting through to staff on the ground. Next slide, please. So I'm just going to quickly take you through some snippets of data we got from a study. Most of this largely comes from a study funded by Health Education England. It was a national study to understand largely why the NHS staff survey results for the ambulance sector were consistently below where the sector would like them to be. So this project was led by colleagues at Yorkshire Ambulance Service, and here at UEA we led some work around understanding the policy landscape and doing some organisational informant interviews. So we started with policy, because for me this is a really important signal of what an organisation says it does and what it says it values. And it's a static, I suppose, point in time call to arms for what an organisation considers important in terms of supporting staff. So across all of the NHS English Ambulance Trusts, we pulled together all of their documents that related to staff wellbeing. So that was everything from a standalone staff wellbeing policy to a rest and breaks policy to an absenteeism management policy, return to work policy. So we pulled them all together to see what sort of story this told us about what the ambulance sector trust valued in terms of staff wellbeing. We then got the real story by going to the people whose job it is to implement these policies and ask them what actually happens when you try and turn these policies and practice documents into action. And then, of course, we went to the staff and asked them, how do they experience it? This is what your trust says. This is what's on offer. How do you intersect with it? And for us, this was really trying to tease apart this tension between meeting operational demands while trying to preserve staff wellbeing and experience. So it's this tension between making sure you're promoting the best patient and service user outcomes, but not at the expense of your staff. And we know this can be a very fine line to tread. Next slide, please. So you don't kind of need to look at all the nitty-gritty detail of this slide, but what I wanted to show you is across our 10 ambulance trusts that we looked at, we did what's called a directed content analysis. So we went into all of these policy and practice documents, and every time we saw an action, so a recommendation to do something, so whether it's having opportunities for sufficient meal breaks, or whether it's providing opportunities for staff to access mindfulness training, we recorded each of these actions across all of these documents. So we had hundreds of actions that we coded from these documents. And we looked at where the emphasis in terms of responsibility lay for these actions. So we coded it as to whether it was an individual responsibility, so staff need to go and do X, or whether it was more phrased in terms of the organisation has a responsibility to provide and assure equitable access to whatever the intervention might be. And we were also really interested in where the balance of approach lay in terms of where there are a lot of reactive actions, so a lot of return to work, managing mental health problems once they arose, versus how much emphasis was given to early intervention or even what we would call primary prevention. So sufficient attention given to appropriate supports for a good diet, for managing disruption to sleep from shift work or even from just day-to-day demands. So we looked across the whole spectrum. Next slide, please. And what you can see was there really was quite significant variation across the trusts. Those two highlighted there had a very big emphasis on reactive strategies. A majority of their actions were around fighting fires, dealing with problems once they'd actually happened. Next slide. Thanks, Heather. This is in contrast to these other trusts where the majority of their documents, the actions that were put forward as what a trust values, were very much around the health promoting, healthy organisational wellbeing, promoting a mentally healthy workplace. So these were trusts that had a real emphasis on things like good line manager training, ensuring staff had strong appraisal processes, because these are really important protective factors for staff wellbeing. They also, of course, had the appropriate safeguards in there for picking up early development of any potential psychological issues amongst staff, and also being able to manage any sort of mental health or other physical health challenges that might arise in staff. But they had much more of an emphasis of kind of this more sort of holistic approach to an organisation and to an individual's wellbeing. Next slide, please. So that's what the policy said. We then went to the people who developed and had the job of implementing these policies across the 10 ambulance trusts. And I just want to kind of pull out 3 themes that came from these interviews. The first was ensuring staff supports were appropriately tailored to the ambulance sector context. And I think this kind of really talks to Kevin's point about understanding the context of the services that are offered to staff and the services provided. And I'll read this quote here, just in case some of you are looking at this on a mobile phone. So this is a quote from somebody who was running a wellbeing service in an ambulance trust. I fought for 3 long and hard years high up, and I mean the board, everybody, to put in place my own recruited, trained, bespoke counselling team who are experienced and trained to deal with trauma. For the ambulance sector, this came out as really, really important because we heard some extraordinary stories of the counsellors or the employee assistance provider service who were brought in to listen to the stories of ambulance staff and to help them. There was instance of a counsellor fainted when the ambulance staff member was recounting what their job was like and what they'd experienced. We had counsellors that were reported that they burst into tears when they were listening to the stories from paramedics. So we have, if we think of our duty of care, we have a duty of care to the people who we bring in to help our workforces. Across the NHS and social care, the nature of the work can be very specific and very different to what a kind of standard counsellor might be used to dealing with. So we really need to make sure the services that are offered are actually fit for purpose for the nature of work that our staff do. Also, what came out really strongly through the interviews, which again matches what was in the policy documents, is balancing individual and organisational responsibility. And here's a quote again from someone who was running a staff support program. Sometimes there was a sense of entitlement from staff around that kind of, you need to fix me. We had to support people to understand that they were capable of supporting their own health and wellbeing alongside us. So I think that's important. It's recognising that partnership aspect. And the final point about balancing wellbeing promotion with managing mental health conditions, and this touches a little bit of some of the cynicism and I think the jaded approach that there can be when we use the word wellbeing. So this person said, I love yoga and Tai Chi, but the idea that things like this will prevent someone from developing chronic stress disorder or suicidal ideation, no, it won't. None of that, insert your own expletive, will work. So I think, again, there's this tension between keeping people well and managing issues what they arise. They're all important, but one can't be seen to be at the expense of the other. Otherwise, you will get issues of perhaps a bit of cynicism and disengagement, even with the people who are tasked with providing these programs. Next slide, please. And finally, just a few snippets of what we then heard from staff. So we went and did interviews in 3 case study trusts to find out how they intersected and experienced the staff wellbeing supports that were offered in their trust. Again, we had this theme of balancing individual and organisational responsibility, but here staff were saying that they get that. They know that part of this is their responsibility as well. So, for example, I personally think that people do need to take a lot of responsibility for their own wellbeing. And also, I've really tried a lot of self-help stuff because at the end of the day, there's no one going to help me but me in this, I think. So I think that one, it's a little bit sad to see this because this person feels almost like they're alone and they're having to manage it themselves. So we want there to be an appropriate engagement with being able to access support and be able to meaningfully engage with it, but not to the extent that someone feels like it's entirely their responsibility to be doing this. Because again, as Kevin has clearly illustrated, that's not the case. Part of this is overcoming barriers to accessing support, such as stigma. And again, apologies for any of you who don't like the language, but I think it's important to reflect how people talk about this. To have the balls to ring, so this is accessing help, when you don't even have the balls to get out of bed is a really big thing. So I think we need to have to think very broadly about the types of barriers that staff are facing. So even when a policy and a wellbeing advisor can talk about all the wonderful supports that are available, what's actually hindering people accessing that in a meaningful way? And finally, this balancing system targets and demands against staff wellbeing, which I started off talking about. I think this quote is really important because it comes to the heart for me about, to some extent, why do we consider it acceptable to implicitly provide a different set of values to staff than we do for patients and service users? So this staff member said, they are coming at it as a business, and I don't think running an NHS service is a business. It goes against the vision and values that they put in front of you and make you preach at your interview that it's about patient care and getting best treatment at the best time. And then this person went on to say that why weren't those same values applied to them as an important part of the service providing community, that it should be thought of holistically as a community. Final slide. So where has this gone in the ambulance sector in terms of what's the next piece of work, what's been done, and how is this going to be brought together to try and affect meaningful change? It was fantastic that the Office of the Chief Allied Health Professions Officer commissioned a project that started last year to try and pull together all the evidence of what was going on in the ambulance sector to try and come out with some coherent national recommendations on what should be done in parallel with guidance on how to implement this in terms of including all perspectives, so not just top down, but building a program from the ground up. So if you're at all interested in how kind of one sector has dealt with this, I'd encourage you to go and have a look at this piece of work, because I think it is going to be used across other sectors of the NHS. So it would be good to kind of go and have a look and see what we've done and to have some input into it. And I'll finish there. Thank you.
Perfect timing. Thank you, Christy. Really, really insightful and poignant quotes and aspects of wellbeing there. So again, there's some lovely comments coming up in the chat. Christy, have a look at those so that we can respond and have a conversation. But Jonathan, I wonder if you can join now to talk us through one of the experiences that was used here at UEA, working with different colleagues during very early phases of lockdown, wasn't it? Do you want to talk us through this project?
Indeed, Sally, thank you. Just to say, the aircraft isn't flying over my head, so
no, it's mine.
I can hear the rumble. So thank you, Sally. So I've just got 2 slides, and what I just want to share with you is work around the centenary of caring. But what I need to say before I even say that is the vision and foundation for this work was led by Sally and by colleagues at Norwich University of Arts. So Associate Professor Carl Rowe and Professor Simon Wilmot. So it was really down to their vision during wave 1 of the pandemic, which led to the development of a centenary of caring. So the centenary of caring was a creative and collaborative partnership between frontline health and social care practitioners from Norfolk and Waveney Health and Care Partnership, working with fine arts students from Norwich University of Arts and UEA School of Health Science nursing students to co-create artistic representations of the impact of the COVID pandemic as seen through the eyes of those affected through lived experience. And this work was also nominated and was a finalist in the UEA Innovation and Impact Awards. And the project used remote discussion groups as participants shared stories exploring how to understand their emotional response to the different scenarios they were experiencing as a result of COVID, and how to capture expressions of what it was like being exposed to COVID during COVID-19 during the first lockdown. And these interactions were used to co-create an artifact shared in a remote gallery space curated by Norwich University of Arts. The initial private viewing, which occurred in February of this year of the exhibition, showcased performances, video capture, photographs, poetry, placards, embroidery and paintings, each bringing to stark focus the emotive elements of human resolve to stay safe and stay strong during the COVID pandemic. So can I just have the second slide, please, Heather? So these are 2 of the quotes that participants shared as part of having taken part in the programme. So one participant said, "For me, this project has been an opportunity to reflect on both my own and other people's experiences of the pandemic. And I've become more aware of the mental strain working during the pandemic can have on those who don't have the same support." And a second participant stated, "My creative piece came about after we spent time explaining our work and the impact of COVID, how we engage and communicate with people safely and effectively so that people understand us and then are able to keep themselves and the rest of their family safe." And a recurrent theme that came about through the programme and this both sort of working with groups and through the exhibition where the creative artifacts were exhibited was about how people had really used creative approaches both to describe their experiences of the COVID pandemic, but also their experiences as part of sort of wider systems, whether that be professional systems or personal systems, and interventions that people took to maintain well-being and a sense of control during a period of time in which people felt, you know, on occasions that they had no control perhaps around what was sort of going on around them as a result of the pandemic. I think a fair reflection would be to say for all of us who joined the exhibition in which the pieces of work were shared and people were able to describe and talk through how they had created their piece of work, was a very emotional experience. And people really described how using creative approaches really helped sort of them to explore in more detail, but actually also as being part of an online group. And what became clear was, you know, sort of we were working in a very different way through virtual groups, through Microsoft Teams, but actually even working in this way, there were still significant opportunities for people to use creativity to really describe and explore and depict to others their experiences of the COVID-19 pandemic. So thank you.
Lovely. Thank you, Jonathan, for that oversight of the project. Heather, next slide, please. So I'll invite the panel to work with me through this slide. So we're back to the notion of trying to balance all of these elements that you've heard about today, all of those experiences that you've had in the workplace where you feel your well-being has been stretched, challenged, or influenced. But actually, I wanted this slide to also show that well-being can be around career. You can have career well-being, you can have financial well-being, social well-being, mental, physical, and community well-being as well. So well-being incorporates mind, body, soul, social, financial elements of who we are as individuals. And I think the strong thing for me is how we relate to others in the world in which we belong. So panel, any thoughts on how you either yourselves or through your work can help to balance the load that we have? And again, like you say, we are adapting now to a new world post-pandemic, hopefully, and different ways of interacting with each other. That is through the medium of the digital technological world. That is affecting people's well-being. We are seeing that research come through. So any thoughts from the panel in terms of how do we balance our workload and our well-being across these different aspects of what's on our poor donkey's back as we understand what workplace well-being means? Kevin, thank you. Do come in.
So yeah, so we've been looking at a number of organisations, and this project Christy works on with us as well, and analysing survey data. And organisations don't kind of take a one-size-fits-all approach that, or the better one. So what they try and do is do multiple things to address multiple concerns. So there might be, you know, there might be specific groups within an organisation where they might set up support network. So some of the organisations during the pandemic facilitated, say, you know, carers to set up a support network. So people with common issues could talk to each other and feel there are people out there undergoing a similar thing. But it wouldn't be just that. So, you know, they'll do multiple things, perhaps around financial well-being, perhaps around sort of career development and so forth. And one of the organisations that we've looked at, not in the past year or so, but previously, they anchored everything in the performance appraisal process. So the performance appraisal process didn't become something around performance as such, but it became a discussion about how you're going to develop as a person, including your health and well-being, and then there are different services on offer, you know, related to what you might want to do. So I remember reading an interview with a guy who was told he wasn't very emotionally intelligent. It was, you know, kind of identified as a development need in the way he managed people, and also in, you know, his experience of relationships in the workplace. So he was facilitated to get a bit of training around that. So what I would say is there seems to be a breadth of coverage, but this dynamic iteration of always looking to try and address what people's concerns are, but again, with the bedrock to go back was what Christy was saying, you can't really ignore the organisational stuff, because that's pretty fundamental. So you've got to get that sorted out at the same time. And I suppose to link to Jonathan's talk as well, this notion of co-production is a very, very good way of addressing people's concerns, involving people in the development of the program of activities itself, because if it doesn't have pace validity with people, people don't think it's addressing their concerns. People won't engage, and you need people to engage as well. But that does bring a tension between evidence-based practice, where you know through multiple randomized controlled trials that mindfulness works, versus someone saying, well, actually, I'd quite like to go and, talk to some donkeys today, and I don't know of any, randomized controlled trials on donkeys. I might be wrong. So there's a little bit of a tension perhaps between, sort of doing something that works because the evidence is out there, versus something that people say, well, look, we think this would be a good idea without too much evidence. But sometimes maybe you just have to go with, what people feel like.
Thanks, Kevin. So Heather, on to the next slide. Thank you. So I just did a very quick search of a plethora of information that's out there at the moment on different approaches, strategies, resources that are available for people to have a look at and think about using. But I think what we're coming up with here is that it is a relationship, isn't it? Well-being, we are relational social beings, and our well-being is very much influenced by the relationships that we have with others in the workplace, but also in our private lives and in our social spaces. But sometimes people do want to be on their own and have a time for a quiet reflection, and there's space in this for all of that. So panel, I don't know if you want to come back on camera, and Carrie, do you want to try and do the difficult task of capturing some of the lovely chat and posing some questions to our panel, please?
Of course, thank you, and thanks everybody for all your useful comments and questions. We may not get through all of them, but I'm also joined by Kim, who may want to hop on camera. And I just say, first of all, overwhelmingly from all the participants, a sense of gratitude for sharing the research work, Kevin and Christy and Sally and Jonathan. So thank you very much. But the first question that was posed came from Kate Sanders, who's asking, is there a distinction between well-being with a hyphen and well-being in the literature?
Yes, there is, but they often get used interspersed, like I said right at the beginning. So some people say that well-being is the psychological, the self-care aspects, and other people say well-being, when it's all squashed together, is the big all-inclusive, and then other people use the terms interchangeably. So Kevin, I saw you saying there isn't really a difference, is there, between those two phrases, really?
No, I mean, I think there are cultural differences. So I think the Brits are more inclined to use well-being without a hyphen, and everyone else was well-being with a hyphen. And I think there are disciplinary differences as well. But I think the movement is towards removing the hyphen. And I think Ed Diener himself, who's the big psych well-being sort of theorist, has stopped using the hyphen as well. So I wouldn't get hung up on it. I mean, I remember when stress was a big thing and everyone got hung up on a definition of stress and no one did anything because they were too busy trying to define it. So, you know.
Thanks for that comment, Kevin. There were some really good comments from Evelyn Kelly from Norfolk and Waveney CCG that says that there's also lots of good Islamic insights into health and well-being too. And she suggested looking at the science of medicine and the art of care with a focus on collective well-being. But I do think that that's an essence that came through the presentation, the importance of people working together in good relationships, as well as effective workplace cultures where everyone can grow and play to their strengths. But there was also a point from Evelyn as in terms of wellness as an active process, rather than a static outcome, which she felt was very important. And I thought that was a very good point to actually illustrate. Kevin, a question for you from Kate Sanders again. When you were talking about wellbeing interventions, she wanted to know if that was based on the assumptions that work depletes employee wellbeing, and therefore the interventions are needed. Whereas from a eudaimonic perspective, it would seem that work with the right organisational support could be a source of well-being.
Yes, yeah. I mean, we know people who are employed are generally happier than people who are unemployed. So yes, it can be, and we know. I mean, I saw Kate's comment when it went in. That in reference to nurses, and we comments Christy was making about, sort of basically, if you look at it, exploiting people because they're prepared to work long hours. You see it in education, you see it in social care. It's and that quote about that Christy put up about not applying the same principles to themselves. I think the thing is to look at it that, yeah, you can have meaningful work from the work that you do, but at the same time, please do not make sure just because someone's motivated to do a good job and they have a very strong vocational ethic and public service ethic that you I was going to use another word, take the mickey out of that. And as I say, it's something we've seen in our work in other sectors other than health and social care, but where you get that public service ethos, vocation, that kind of thing. So yeah, work is good work's good for you.
Yeah, good work's good for you.
Yeah, that adjective is really important.
Yes, the good work and how you define good work. Christy, there were some interesting comments for you from some of our participants who work in the sector, in the ambulance sector. So they were saying that the quotes from your research really resonate. But there was a question really about people needing to look at how they are managing within their teams to actually provide space for well-being. But there was a real challenge around how you find time to do that in a meaningful way. And there was some discussion then about how we create space to enable people to stop and reflect. And I think, Kim, you jumped in on some comments there around finding the time and space to reflect. I don't know if you want to comment on that.
Only that time is finite and it's our decisions collectively what we do with that space and time. Yet the work from Michael West shows that having time to reflect and stop enables us to be more effective and productive.
Yeah.
So it's really agreeing together what the priorities are in terms of the time that we have.
Yeah. There was a really good point from Fua Hagen in Croydon, Christy, that has asked that about, she's very curious to know what's out there in terms of supporting managers, even though that came out as a theme. So what's out there to support managers? And whilst you'd identified that there was counselling, etc., and bringing people in, it's often staff not knowing what's available and then being able to access what's available, particularly when you haven't got a lot of time, that may be one of the issues. So it's just a point to make. And then Kate Sanders had brought up the question that not all wellbeing interventions are appropriate. And so if they're not appropriate, it may also be that the measures that are being used to evaluate them are not appropriate. So there's a critical question. I suppose it depends on who's implementing those interventions and how they're being used.
And I think that's Christy's point exactly, yeah. Isn't it, from her study? Christy, I don't know if you want to come in there.
Yeah, absolutely, because I think, and there's two parts to that. Is what's being provided an evidence-based intervention as far as we know, because it seems to be sometimes there's a different threshold for evidence requirement for what we do for patients and service users versus what's offered to staff. And I think that's an important disconnect that we need to tackle, but also to help trusts find the space and the energy to evaluate what they actually do. Because I think that quote I started with about throwing everything at it, that's really important to unpack that and understand, because a lot of things are rolled out, often together, often perhaps competing against each other. We need ways to better embed evaluation in this so that they can become learning organisations, that service improvement model, making sure staff are encouraged to apply that to their own working experience as well, not just to kind of have that focus on kind of service demands, but almost validating that this is really appropriate, important to gather that evidence around what's working on the ground in terms of staff wellbeing and staff experience as well. And I think importantly, I will just flag in that those of us that kind of work in staff wellbeing, we spend our time talking to service users and public and patients as well. And I can tell you they really, really do value effort being put in to understand the staff experience and improve it as well. They can see when staff are tired, they can see when staff are perhaps not at their best. So they're really behind research in this as well, which I think is important to acknowledge.
Yeah, it's a really good point, Christy. There was a lot of very positive comments about staff being listened to and being included. But there's also comments about using creativity to enable people to have a voice. And so, Jonathan, there was some very positive comments about the centenary of caring projects that we were all involved in, and enabling people to tell their story. And also, one participant has identified that perhaps the pandemic has done us a little bit of a favour in the sense that remote working has increased some flexibility and enabled people to integrate work with the rest of their life, perhaps in a way that they hadn't had chance to do so before, although that's not a universal experience. So I'm really mindful we're out of time, Sally.
Thank you,
so
Carrie.
I'll close it there and say thank you to everybody and just let them know that the link will be sent out to the webinar after this on our YouTube channel. Thank you.
Okay. Jonathan, do you want to say a couple of words briefly about the next webinar, please? And then I'll close this session.
Of course, Sally. I'm just wondering, my colleague Kate Sanders, I know, is dialed into this. Kate, do you want to come online as well? Because we're going to be co-presenting the next webinar in October, if you're able to. So just to say that our next webinar, so we're having a 2-month break. Our next webinar is on the 12th of October, and I am presenting with my colleagues Kate Sanders, Sean Cardiff and Kim Manley on developing shared values which are central to effective workplace cultures that are good places to work. And this work, we hopefully will be able to illustrate some national work that Kate and I, so the Foundation of Nursing Studies and the Impact Research Group are working on at the moment around working with community nursing teams across England to pilot and test the guiding lights for effective workplace cultures. So we're not guaranteeing that we will be able to share examples, but we will certainly be drawing on our thinking and learning from being involved in that national piece of work. So we look forward to seeing you then.
Thank you so much. Okay, final slide then, Heather, and that really is it, folks. Thank you so much. Our emails are there. Should anything have been raised with you and you don't know where to go for advice, support, or just one of those critical conversations or some time for reflection, then do get in touch with any of us here. And again, I'm sure Kevin and Christy will also be available to talk to you about their research. So you should be able to find us through these connections. Thank you, everybody, for sharing this last hour with us. I hope it's been meaningful. And I just love that notion that we are co-creating our new gestalt about understanding well-being in the workplace. So thank you, everybody. And I look forward to seeing you and speaking to you again soon. Thank you all.